Hi class, welcome back to Social Work 648. We are entering week 2, and in this video I'm going to go over some of the key concepts in this week's reading from the Pickover and Brown text about burnout, compassion fatigue, and the ethical implications of self-care and boundaries. In the text, they combine a lot of these concepts. The authors talk about these concepts kind of all in the context of burnout. And I want to spend some time teasing out the different issues involved in each of these definitions and trying to understand them independently, as well as how they all work together to contribute to your well-being as a practitioner, whether in the public child welfare system or in any social work context where you're working with families in situations of vulnerability and with high levels of needs. The first concept that is discussed in the text is that of countertransference. The definition that they provide is that it's the therapist's feelings, thoughts, and behaviors that occur during the process of therapy. The therapist derives these feelings, thoughts, and behaviors from her own personal history of often unresolved issues. When these feelings are not acknowledged, they can be transferred onto the client, and the therapist acts toward the client as if the client is making the therapist feel the emotions. This is when your stuff, your own personal issues, are placed at the table in the interaction with the client. In other words, this is where we currently talk more about trigger alerts. This is where the client's experiences are triggering your own. Whether you've dealt with them or not, they are part of your story and they're part of your worldview. And so sometimes it can be difficult to not have them triggered and bring them to the therapeutic relationship. So it's important to be aware of those things. How do our own culture, values, personal experiences, history, socioeconomic status, race, sexuality, religion, any aspect of ourselves or our experience influence the way that we view and interact with clients? This is where we need to really reflect on whether our personal experiences and views have a prominent seat at the table. There are many people in the room, essentially, when you are in a therapeutic relationship, right? You have the client, you have the agency's expectations, you have the system, you have their own kind of history and what's being brought. And so the question is, are we allowing our own personal experiences and views to also have a prominent seat at the table? Do we find that the client's experiences are triggering something in us that's difficult to leave outside of this relationship? That's when we really need to engage in self-reflection about the things that we're bringing into the room and whether or not they're impacting our ability to work effectively with that client. Empathy. This is the willingness to feel what the client feels and see the client's worldview from the client's perspective. Empathy requires a strong ego foundation and effective self-awareness. This is not sympathy or pity or judgment. Those are concepts where we are distancing ourselves from the client, maybe feeling bad for them, maybe blaming them for their own situation, kind of protecting ourselves from being able to really feel and acknowledge the true feelings that the client has about their situation. We want to be able to feel genuine and appropriate emotion for their experiences and with them without becoming the center of the story. This is where that strong ego foundation is, and being truly self-aware. Do we know who we are as people? Do we know who we are as practitioners? Can we allow the client to feel all of the strong emotions that they feel without being sucked into that? Can we feel with them without losing ourselves in the story or allowing our own emotion to take over and become the center of the story? Vicarious trauma. This is when we have a steady exposure to clients' pain and the trauma that they experience and how it impacts the social worker. This is when you may see that the social worker is beginning to exhibit trauma exposure symptoms like recurring intrusive images, depression, anxiety, stress. It can lead to emotional exhaustion. This is the result of empathizing with trauma stories of clients and absorbing the impact of trauma and then feeling the impact of that trauma. This is when we may hear stories over and over and over again, and without necessarily experiencing a similar trauma, we start to exhibit the symptoms as though we have. Compassion fatigue, so while in the text they combine a lot of these concepts, again, they're combining compassion fatigue with vicarious trauma, with burnout, and I think it's really important to separate them because I do think that there are differences between the way that we understand these different concepts. So there's a different author that I've brought into the conversation here outside of the text that I like the definition that they provide of compassion fatigue. This author says, compassion fatigue is caused by empathy. It's the natural consequence of stress resulting from caring for and helping traumatized or suffering people. It involves a preoccupation with an individual or his or her trauma, and it doesn't require being present at the stressful event. So I think we're kind of signaling the vicarious trauma piece. Simply being exposed to another person's painful narrative can be enough. Compassion fatigue is the convergence of primary stress, secondary traumatic stress, and cumulative stress in the lives of helping professionals and other care providers. I like to think about compassion fatigue as the result of the vicarious trauma and exposure to other people's trauma stories. It's the result of being a person who exhibits a lot of empathy and enters into the painful experiences of others in order to support them and help them heal. Compassion fatigue is the consequence of over and over investing yourself as a necessary part of therapeutic relationships. Compassion fatigue can exhibit itself in many different symptoms, such as these, also discussed in the Portnoy article. Cognitive, such as lowered concentration, apathy, just not caring anymore, being rigid about perspectives, disorientation, minimization, preoccupation with trauma. Emotional impacts, such as powerlessness, feelings of anxiety, guilt, anger, numbness, fear, helplessness, sadness, depression, feeling depleted and empty, being in shock, feeling blunted or having an enhanced affect, so kind of overdoing it or underdoing it. Experiencing troubling dreams, similar to a patient's dreams, suddenly and involuntarily recalling a frightening experience while working with a patient or family. Behavioral impacts might be irritability, feeling withdrawn, moody, having poor sleep, nightmares, appetite changes, hypervigilance, isolating yourself, spiritual questions, and these are very important because they can really impact kind of your overall well-being and overall state of mind. These are things where you start to question life's meaning, feel pervasive hopelessness, have a loss of purpose, question your religious beliefs, lose your faith, or feel skeptical or cynical about everything. Somatic symptoms might be sweating, rapid heartbeat, breathing difficulty, aches and pains, dizziness, impaired immune system, headaches, difficulty falling or staying asleep. You might experience all of these things or some of these things, and obviously those of you who know and understand depression or anxiety or trauma symptoms, these things may combine with other things that you have experienced in your life. But the reason that we put these here is that these are direct results sometimes of constant work with people who have been traumatized and the engagement in the therapeutic process or the helping process with those people within systems that also place the pressure on the client system and you to be able to engage effectively in that helping relationship. So I want to kind of center these symptoms and center the idea of compassion fatigue as something that is not necessarily a final thing. So a lot of people talk about compassion fatigue as, a contributing factor of burnout, and I'll get to burnout, but the idea that it's final. Sometimes it is, but sometimes we need to think about it on a range of experiences, and that symptoms of compassion fatigue can be signals for when we need to take better care of ourselves or make adjustments to our work or take time off or find other ways to rejuvenate and become reconnected to our purpose and reconnected to the meaning of our work, reconnected to the positive aspects of our work in order to be able to re-engage effectively and in a healthy way for yourself and your clients. So that leads us to burnout. And I separate burnout here from compassion fatigue because I think it's important to look at the institutional contribution to the emotional exhaustion of helping professionals. Compassion fatigue is the direct result of being with people all the time who are in need, who are requiring significant investment from our emotional resources into their healing process or into their process for kind of navigating the system and your accompaniment of them. Burnout, I want to highlight the effects of working within bureaucracies, trying to do this work within a system where there are limited resources and increased pressures, unrealistic expectations, poor administrative or supervisory support, multiple competing demands, political pressures. We can also look at and should look at the constant effects of systems that are designed to promote certain political priorities that may not align with our own or may not align with our sense of values or sense of social justice. We also need to look at the fact that systems are impacted by institutionalized racism and classism, and that those attitudes and values of dominant society may be interwoven with the policies that impact our work with people, and that constant struggle of being with people in need and also needing to struggle against the system that sometimes aims to kind of keep them in place and keep the status quo in place can be exhausting. And so burnout is kind of the result of that constant struggle of being in a compassionate field and also needing to navigate the real life work demands and stresses. Sometimes we have mismatched priorities. So burnout can be the result of the demands that the system places on those people who work within it, people who are expected to promote safety, but are placed in unsafe working situations, for example. This situation can contribute to physical, spiritual, and emotional impacts, much like the ones that we just looked at for compassion fatigue. But there's a lot of research that looks at the fact that burnout leads to poor work performance, absenteeism, calling out of work, dissatisfaction with work itself, somatic complaints, so feeling headaches and body aches and stomach aches and getting sick very often, decreased immune system, and then obviously a very negative impact on work-life balance. This is when you may start to see people's experiences at work really spilling over into the practitioner's life at home. And burnout, similar to as I mentioned with compassion fatigue, burnout can be something that starts kind of mildly, where you can start to see symptoms of feeling exhausted by the system or feeling burnt out by your workload or feeling like you cannot keep up or you cannot meet the demands of your employers. It can be something that signals change in some of these areas in order to regain some balance or regain a sense of perspective. Or, at its most extreme, can lead to serious physical repercussions that require you to leave that particular field. And we've all seen examples of that. So we want to be aware of these things and aware of the kind of signs and symptoms of compassion fatigue and burnout before it gets you to that place where you feel obligated to leave in order to protect your health. I'm going to talk about a change in perspective and kind of boundary setting and the ethical dimensions of really kind of a holistic self-care practice in order to prevent that. Because what our field needs are professionals who are committed to caring for themselves in order to care for other people and not kind of walking around in a constant state of exhaustion. Obviously, that's very hard sometimes, but I'm going to present it kind of in an ethical imperative frame in order to kind of make us aware of our responsibility for making choices and engaging in the work in a way that maybe promotes that more than gives into the system's expectations, which do often lead to burnout. So the next few slides I'm going to talk about kind of in an ethical context, practices and perspectives that we kind of need to maybe adopt a little bit more in order to maintain a sense of healthy perspective on our work and not lose ourselves, become totally absorbed in the work, in the practice, in the client's trauma stories. So first and foremost, it's important when working with vulnerable families, whether in social service agencies, whether in child welfare, whether in the healthcare setting, when we're working with families with complex trauma and a long history of involvement with various systems, boundaries can be blurred and expectations can be blurred and our desires to help can be blurred with different factors that impact that family. So it's important to maintain a sense of personal boundaries as you engage with that family. So it's important to be clear about roles and responsibilities up front. Who do you represent within this helping relationship? What are your reporting obligations? What is your professional role? What are the timelines within work, which work needs to be completed? What are the expectations for you within that helping relationship? And what conflicts of interest do you have? It's important to remember that you are not your clients. As deeply involved in their lives as you might be, you bring to the relationship your own privileges, your own experiences, and your own ability to leave that situation and separate yourself from it. This is where you need to remember that your story is not their story and their experiences are not your experiences. It's important to avoid becoming overly absorbed in clients' lives. Also, avoid feeling like their experience overrepresents your own. You want to identify any triggers that work with them may bring up in you, and this is where it's really important to do your own work on yourself in order to kind of recognize when those triggers happen and work through them in order to keep a healthy perspective on your work with that family. It's also important to remember that you are not the client's entire life. This is where we need to kind of keep perspective on the big time frame. We are one piece in this one moment in time in this client's life, and sometimes we work with people for a very long time. And your role may be very significant. You maybe have a significant impact on this family's story. But we are not their story, and we are not the entire life. And so we shouldn't assume we are or force ourselves into the central role of that family's story. Try to minimize self-importance. Look for the family's strengths and the way that they are working kind of without your intervention. How do we kind of demythicize and de-romanticize the role of the helper? There are a lot of stories out there kind of about, those movies where there's a teacher in an inner city school that comes in and kind of rescues the children from their own circumstances because of that teacher or that person's personal impact. And it's a very romantic notion, and while certainly there are a lot of amazing stories, we need to keep the client's experiences as the central piece rather than the focus on the work of the helper themselves. I want to also mention that helps kind of take some of the pressure off of the responsibility that your impact is going to be the only impact that helps this client move forward. We need to kind of think about our work as part of a constellation of actors who are involved in helping these people move forward. It's very important also to remember that your clients are not your entire life. It is talked about a lot, but the importance of a work-life balance cannot be understated. This is important for maintaining a sense of perspective on your work. If you are not in this role, who are you? That can be a painful conversation to have with yourself, and it's something that's important to reflect on. But what else in your life gives you joy apart from this work? Whether it's your family relationships, whether it's your significant other, whether it's your pets, whether it's your relationships in the community, your church, your synagogue, whatever it is that you are a part of, how do you define yourself apart from the work that you do and the impact that you have in other people's lives? This conversation is one that I highly encourage you to have as often as is necessary with yourself until you gain a sense of understanding of who you are apart from your professional identity. Because the more pressure that you place on your meaning only in the context of your professional work, the more difficult it will be to separate yourself from that when things get really hard and things start kind of losing some of their meaning because of those issues of compassion fatigue that we talked about earlier. And so this is where it becomes important to take into account your professional context and the expectations of your specific role. So obviously some roles have more responsibilities than others, and it's harder to kind of separate yourself and place limits. But it's really important to kind of have honest conversations with yourself when experiencing questions of compassion fatigue or burnout, or just kind of feeling a little bit overdone in the work setting. Trying to clearly define what are your actual responsibilities versus those that you take on for yourself. A lot of workplaces may have, very kind of supportive policies, but, and so in writing, there's a clearly defined work schedule, there are clearly defined roles, there are clearly defined kind of support practices in place for talking with supervisors, the chain of command, etc., filing complaints, all of that. But then in practice, the cultural expectations may be very different. So there may be some punitive kind of historical practices within that agency for complaining about work-life balance or punishing people or perceptions of punishing people for kind of insisting on personal time. So explore what are the actual and cultural expectations for overwork. Is it something that is just because the boss does it, that everybody else feels obligated to do it, or is it something that's written? Is your hours? Is there any kind of way to work around that? Whose responsibility is it to fix the systemic problems? Sometimes our desire to help people and make things better within our agencies or within the systems in which we work, we will give everything we have in order to fix these problems. And while that should be our long-term overarching goal, is it your responsibility to fix these problems right now, or can you take a few steps back in order to kind of recover and allow other people to step in to do some of this work? What excuses do we make for taking work home? What I have found in practice and kind of in talking with professionals from a great variety of settings is that when we get into the habit of taking work home or becoming consumed by work, we tend to make a lot of excuses for why that needs to happen. And so I'd encourage us to kind of think about whether or not we are making excuses for giving in and engaging in overwork. And then are clients served by that? Are our clients actually any better off by us working until 9 or 10 o'clock at night once we get home? Or are we just more tired the next day? Are you contractually obligated to be on call for 24 hours a day, which some roles are, and so that's obviously some different kind of shift that needs to happen? Or do you just feel like you need to be available for your boss or for your clients whenever they need to be? Again, that comes into this actual expectations versus kind of cultural expectations. Do you just feel like you need to be? Are you checking your email at home, receiving constant alerts on your phone, checking your voicemail on off hours, answering calls? Again, is this something that is part of your job description and therefore needs to have kind of accommodations built in around that? Or is it something that you have fallen into the habit of doing for a variety of factors? Do you have a stated or typical departure time from work? Sometimes because we're just trying to get our work done, we stay until 7 o'clock at night. But that then becomes the norm. And so have you stated with the supervisors or whoever it is that makes those decisions, kind of like, my departure time is 5:30 p.m. or whenever it is, and then try to stick to that and accommodate your work within the working hours and allow the system to try to adjust itself? Or do you just kind of fall into that pattern and then it becomes assumed that you're always going to be working late? And then again, these are a lot of reflection questions, but do we sometimes make choices to increase our need to be needed? This goes into that question of excuses that we make for ourselves and engaging in overwork. Sometimes helping professionals need to feel needed. And so the question is, are we doing things because they have to be done and the client will be harmed if we don't? Or do we sometimes do things because we feel kind of more important or more needed? And that's not the case all the time, but sometimes it may be a factor that we need to kind of consider. And then again, will overworking fix the systemic problems that impact clients' lives? Will overworking allow a traumatized family to heal any quicker? Or will it ruin your own personal balance and your ability to approach the work in a healthy way? So we each have an ethical responsibility to care for ourselves in order to be effective practitioners. We should assume that the system does not care about you. And that may sound harsh, but the bureaucracy is functioning because it is set on rules and roles and assumes that people participate in bureaucratic functioning in the way that it's designed. It is not designed around, generally, human compassion and human limits. It's important to remember that in order to care for yourself, you have to be militant about defending your time and your own personal sense of health until it becomes second nature. Developing healthy boundaries is your responsibility if you're working within a system that does not provide that for you. I like these two quotes about self-care, and self-care is not self-indulgence, it is self-preservation. And rest and self-care are so important. When you take time to replenish your spirit, it allows you to serve others from the overflow. You cannot serve from an empty vessel. Self-care, in my definition and in the way that I want to present it, is in the context of that providing services to people in situations of vulnerability with many needs, the system will take every opportunity to use you up. Your sense of moral obligation, spiritual calling, professional duty, passion, personal commitment, etc., will likely make you willing to suffer on behalf of others' needs, often to the neglect of your own. This is not sustainable. It's important to remember that. And while all of those motives are important and valuable, the cumulative effect of being willing to suffer on behalf of the work itself is not a sustainable model for the long haul. So in our climate, it's our responsibility to approach this work with a mindset of self-care. Not necessarily having time or money to engage in regular manicures or bubble baths or whatever. I define self-care as any practice where you take the time and space that you need in order to replenish yourself for the fight over the long haul. These boundaries in the context of self-care are not about maintaining distance from clients and becoming impersonal. but they're intended to prevent you from becoming absorbed and lost into the pain and dysfunction of others' lives and the systems that impact us. And so being committed to self-care helps you maintain your own identity within the helping process and maintain a commitment to your own health and well-being throughout the interactions and the work that you're engaged in. So I hope that you find your own self-care practices, whatever they may be, and that they come from a place of commitment to your own health, and recognize that that contributes to the healing of vulnerable families and our society, which is in great need of practitioners who understand that.